Hi, I'm Dr. John Rush, founder of Arthritis Knee Pain Centers. If knee pain is slowing you down, today I want to talk to you about a simple, non-surgical treatment that has helped thousands of people get back to living the life they love: knee gel injections, also called viscosupplementation. What are knee gel injections? Knee gel injections use a natural substance called hyaluronic acid, something your body already makes to keep your knee joints cushioned and lubricated. However, when you have osteoarthritis, the cartilage wears down, and your knee loses this vital fluid. That leads to grinding, stiffness, swelling, and bone-on-bone pain. These gel injections can help reduce some of that lost lubrication so the knee can move more smoothly with less friction and far less pain. You might be asking how knee injections work. Think of your knee like a hinge on a door. When it's lubricated, it opens and closes effortlessly. However, when it dries out, it sticks, grinds, and wears down. Hyaluronic acid acts like a shock absorber, helping to cushion and lubricate the joint, reduce inflammation, improve mobility, ease stiffness, and support long-term joint health. This treatment is done right in our medical practice. It takes just a few minutes and there is no downtime. We ask our patients just to take it easy the rest of the day they have their injection and maybe ice their knee 10 to 15 minutes 2 to 3 times that day. They can get back to normal activity the very next day. Some people experience relief immediately after treatment. For others, full relief usually begins within a few weeks. The treatment can last up to 6 months or even longer and can be repeated as often as every 6 months. The gel must be delivered directly into the joint space for these knee gel injections to work. That's why accuracy matters so much. But here's a challenge. Without imaging, even trained physicians can miss the knee joint 9 to 29% of the time, according to published studies. That's why at Arthritis Knee Pain Centers, we use fluoroscopic digital imaging, a real-time live motion X-ray to guide every injection with pinpoint accuracy. This ensures maximum pain relief, better treatment outcomes, safer, more comfortable injections, and longer lasting results. Arthritis Knee Pain Centers always uses fluoroscopic guidance, which sets us apart from many other providers. So here's what a knee joint injection will look like. First, we prep the knee with chlorhexidine. We then spray a little ethyl chloride. It's like freezing the skin, putting an ice cube on it so you don't feel the needle as much. We inject a little bit of lidocaine and may remove some excess fluid to make room for the gel. Using fluoroscopic imaging, we guide the gel exactly where it needs to go. The actual injection takes only a few seconds. You walk out afterward with minimal restrictions. Most of our patients say treatment is quick and nearly painless. Many patients begin feeling relief after their first injection, and some say their knees have never felt better in years. The long-term benefits of knee gel injections are to reduce or eliminate knee pain, improve walking, climbing up and down stairs, and everyday movements. They can help you cut back on pain medications. They can help you delay or even avoid knee replacement surgery. They can help you stay active with less discomfort, and they will improve your flexibility and mobility. Osteoarthritis is a chronic, indolent, and progressive disease. There is no cure, but our treatments can help slow down the progression of the disease and get you out of pain. At Arthritis Knee Pain Centers, we don't just treat the symptoms. We take a multi-step approach that may include offloader knee braces to reduce pressure on your joints, joint health supplements, daily walking, and simple exercises. When combined with gel injections, many patients experience even better relief. So you may be asking yourself some questions. Are knee gel injections safe? Yes. The FDA approved viscosupplements in 1996. Side effects are usually very mild, such as some temporary soreness or swelling. How long do the results last? Most people feel relief for about 6 months or longer. Treatments can be safely repeated every 6 months or so. Does insurance cover these treatments? Yes. Many insurance plans, including Medicare, do cover knee gel injections when medically necessary. And your initial screening is always at no charge and no obligation. Are results guaranteed? No. No medical treatment works for every patient, but using fluoroscopic imaging gives you the best possible chance for success without painful knee replacement surgery. What if I've already had a knee replacement? We have other treatments at Arthritis Knee Pain Centers that may be a good option for you. A no-charge screening helps us tailor the treatment that is right for you. Knee pain is real, and it does negatively affect people's lives. Listen to what one of our patients, Paul, had to say in his online review of this procedure. I felt relief after the very first injection, and I felt the best I have in 15 years, and I would recommend this place to anyone. Take the first step toward getting your mobility back. Don't let knee pain rob you of an active and fulfilling life. Our team has helped more than 70,000 patients avoid surgery and opioids while getting real, long-lasting results. To schedule your no-charge, no-obligation screening, call us today at 1-855-430-7251. We're here to help you move comfortably, stay active, and feel like yourself again.